right now, this very moment, while you're sitting down watching this, your blood pressure is likely being managed wrong and you don't even know it. If you're over 70 and your doctor just pushed your pressure down to 120/80, you need to hear this. A landmark study published in JAMA Internal Medicine, 15,000 seniors tracked for 5 years. What they discovered, it shatters everything your doctor learned. The seniors with quote-unquote perfect blood pressure, 120/80, they had a 28% higher risk of serious falls, of fractures, of losing independence in just a matter of weeks. But the seniors with moderate pressure elevation, 135 to 145 systolic, they lived longer, stayed sharper, kept their freedom. This isn't a small finding. This changes everything. I'm Dr. Michael Kent. For 2 decades, I've watched the system teach doctors one universal rule: lower the blood pressure. Always lower it. For everyone. But that rule, it's destroying people over 75. And I'm going to show you exactly what's happening in your body. Why your medications might be your worst enemy. And the one test you can do tonight that could prevent a catastrophic fall. But first, where are you watching from? Drop your country in the comments right now. Just your country. Because this information applies differently based on where you live, what medications are available to you, and what your local guidelines say. I want to see who's watching, because you're part of a community right now learning something your doctor probably hasn't learned yet. Here's what's happening in doctors' offices across the country. Every single day, an 80-year-old walks in. Blood pressure reads 152/84. The doctor pulls up the guidelines on their screen. They see the target, less than 130 systolic. And immediately they reach for the prescription pad. One medication becomes two. Two becomes three. 3 months pass. Blood pressure looks beautiful on paper. 122/76. The doctor is satisfied. You get a gold star on your chart. Everyone celebrates. But here's what nobody checks. That same 80-year-old stands up to answer the phone, and their pressure crashes. From 122 sitting down to 95 standing up in just a few seconds. Their brain isn't getting enough blood. The room spins. They reach for the wall, but they miss. Now we're not talking about numbers anymore. We're talking about a fractured hip, emergency surgery, 3 weeks in a rehab facility, and then loss of independence, infection, complications, sometimes death, all because blood pressure was lowered too much. Meet Robert. He's 76 years old, retired school teacher, lives in a small apartment, loves reading, plays chess on Sundays with the guys from his community center. 2 months ago, Robert walked into his doctor's office. Blood pressure was 158/88. His doctor looked serious. Robert, the doctor said, we need to get this under control. I'm adding 2 medications today and possibly a third in 6 weeks. Robert didn't argue. He trusted his doctor. He took the medications dutifully every single day. Now, here's what your doctor won't tell you, because they don't have time to explain. Or worse, they don't actually know your body changes fundamentally after age 75 in ways that make standard blood pressure targets potentially dangerous. 3 critical changes happen, and they all point to the same conclusion. You need different targets, not lower targets, different targets. First, arterial stiffness. When you're young, your arteries are flexible, they stretch, they expand, they absorb the shock of each heartbeat. But as you age, these arteries become rigid. Think of a garden hose that's been left in the sun for 20 years. Brittle, stiff, can't flex. Your body doesn't adapt well to rapid pressure changes anymore. When a young person stands up, blood pressure stays steady. But your stiff arteries don't absorb the pressure wave the same way. You actually need slightly higher baseline pressure to maintain blood flow to your brain, to your kidneys, especially when you're standing upright fighting gravity. Second change, baroreceptor function declines. These are tiny sensors in your blood vessel walls. They detect pressure changes instantly, send signals to your brain, trigger compensations. When a young person stands, these receptors fire within milliseconds. Heart rate increases, blood vessels constrict, pressure stabilizes. But these receptors get slower with age, much slower. They respond to pressure changes like an old animal sensing danger, delayed, sluggish. By the time they react, you're already dizzy, already falling. Margaret is 81, a retired nurse. She raised 3 kids. She has 6 grandchildren. She volunteered at the library for 15 years. Margaret came to see me 3 weeks ago, looking worried, embarrassed even. Dr. Kent, she said quietly, I'm falling, not just stumbling. Actual falls. My left knee is bruised. My right hip hurts. I don't know what's happening. I asked about her blood pressure medications. She rattled off 4 names, 4 different medications, all added over the past 18 months. As her pressure kept getting closer to that magical 120/80 target. I checked something my colleagues rarely check anymore. I had Margaret sit down, rested her for 5 minutes, checked her pressure, 118/74 looked great. Then I had her stand up immediately and checked again, 92/58. A drop of 26 points systolic and 20 points diastolic. Her brain was being starved of blood flow every single time she stood up. The third change, your medication metabolism transforms. Your kidneys don't clear medications as efficiently at 81 as they did at 51. Your liver processes drugs more slowly. A dose that's perfect for a middle-aged person lingers in your system, builds up, hits harder. That blood pressure medication that dropped your pressure perfectly at age 55, at age 85, it can be excessive, dangerous, pushing you too low. Now, let me tell you exactly what the research actually found and why this changes everything. The JAMA study I mentioned, published 2022, followed over 15,000 adults aged 75 and older, not handpicked healthy seniors, real world people with diabetes, with prior strokes, with heart disease, with various levels of frailty. The researchers divided them into groups based on average systolic blood pressure below 120, 120 to 130, 130 to 140, 140 to 150, above 150. Then they followed them for 5 years, monitoring falls, monitoring hospitalizations, monitoring what actually happened to them. Here's what shocked the researchers. The lowest mortality rate, the fewest falls, the best quality of life occurred in the group with systolic pressure between 130 and 140. 130 to 140, not below 120. The group that achieved that textbook perfect 120/80, they had a 28% higher risk of serious falls requiring hospitalization, higher rates of acute kidney injury. Their kidneys couldn't function with pressure that low, and their overall mortality rate was 14% higher. Think about that. 14% higher mortality for achieving what everyone says is the perfect blood pressure number. The group above 150 had problems as expected, more strokes, more cardiovascular events, but very low pressure was equally dangerous, dangerous in different ways, but equally dangerous. Robert called me 3 weeks after starting his medications. His voice was different, worried. He said, "Dr. Kent, I feel strange. When I stand up from my chair, the room tilts. When I reach for a book on the high shelf, I feel faint. I'm scared I'm going to fall." So I asked him to come in. I did the exact test I later did with Margaret. Robert lying down, 145/82, looked great on paper. Robert standing up, 98/61, a drop of 47 points, systolic. His medications had been lowered his pressure too much, and his baroreceptors couldn't compensate because they'd become sluggish with age. Every time he stood, his brain didn't get enough blood. This is the test that could save your life. And 95% of doctors don't do it routinely. It's called orthostatic vital signs measurement. Orthostatic means relating to standing position. Listen carefully. This test takes 3 minutes. You can do it tonight in your home. You need a blood pressure monitor. They cost about $30, available at any pharmacy. Here's the exact protocol. Lie down on your bed or your couch, completely flat. Rest for 5 minutes. Just rest. No phone, no distraction. After 5 minutes. While still lying down, take your blood pressure, write down both numbers, the systolic and diastolic. Now stand up immediately. Don't wait a minute. Don't ease into standing. Stand up now and immediately take your pressure again. Write down those numbers. Now compare. If your systolic dropped by more than 20 points or your diastolic dropped by more than 10 points, you have orthostatic hypotension. This is critical. This means your medications are likely too strong for your body right now. Even if your sitting blood pressure looks perfect, if it's dropping that much when you stand, you're operating on insufficient pressure when upright, and that's dangerous. Margaret's results when she did this test at my office, lying down 118/74, standing up 92/58, that's dangerous. If you find similar numbers, this is conversation to bring to your doctor, not a reason to panic, but a reason to advocate for yourself. So what should your blood pressure actually be? The research gives us some guidance. These are ranges, not absolutes. Your individual target depends on your complete health picture, your other conditions, your functional ability. What matters is the conversation with your doctor. You now have information to bring to that conversation for adults aged 65 to 74, who are generally healthy and active with no major medical conditions. Research supports a systolic range of 130 to 140. This gives cardiovascular protection while maintaining adequate blood flow to vital organs for adults 75 to 84 who are relatively healthy. The evidence suggests 135 to 145 systolic is appropriate. This is higher than the younger group because of the changes I explained. Arterial stiffness, slower baroreceptors, different medication metabolism for adults over 85, or for anyone frail regardless of age. A systolic range of 140 to 150 may be most appropriate. At this stage, preventing falls and maintaining quality of life often becomes more important than aggressive blood pressure lowering. The diastolic pressure, the bottom number, often gets overlooked, but it matters. It should stay above 65, ideally between 70 and 85, Very low diastolic pressure reduces blood flow to the heart muscle itself. Paradoxically, can increase heart problems. James is 73. He's a retired accountant, logical mind, skeptical. He had a minor stroke 5 years ago. Left him with minor weakness on his left side. He's very aware of his cardiovascular risk. When James came to see me, his blood pressure was 148/85. Given his stroke history, his doctor wanted him aggressively treated. Target 120/80 or lower. So James started medications, meticulous man. He took them exactly as prescribed, checked his pressure multiple times a day obsessively. 1 month passed. His pressure was 122/74, perfect on paper. But James called me. Dr. Kent, he said, I'm exhausted. I can barely think straight. I'm walking through my house like I'm in a fog. I did his orthostatic test. Lying down 122/74, standing up 103/59. 20-point drop systolic, 15-point drop diastolic. It was borderline. But combined with his symptoms, it was clear. His pressure was being lowered too much for his physiology. Now here's the critical part, and I need you to hear this clearly. If you're taking blood pressure medications right now, do not stop them. Do not reduce them without talking to your doctor. But do this. Try the orthostatic test. Bring those results to your appointment and have an actual conversation. Not a checkup where you sit for 7 minutes and leave. A real conversation. Ask your doctor these questions. Is my current blood pressure target appropriate for my age and my situation? Have you checked my orthostatic pressure? If my standing pressure is significantly lower than sitting, can my target be adjusted? Can my medications be reduced? These are not adversarial questions. You're not challenging your doctor. You're asking for individualized care. Based on recent research, Margaret did the orthostatic test at home, brought the results to her cardiologist. The cardiologist was impressed, said, I should have checked this. I'm reducing your medications today. Within 2 weeks. Her dizziness stopped. Within 6 weeks, she'd had no falls. Within 3 months, her blood pressure was 138/80. And her medication list had gone from 4 drugs down to 1. She told me recently, I feel alive again. I'm not scared to move. I went back to the library. I'm volunteering 3 days a week. So what about someone like James with a history of stroke at higher cardiovascular risk? How do you balance the need to prevent stroke with the need to prevent falls? The answer isn't aggressive, lower. The answer is individualized. With careful monitoring for someone like James, with his history, a target of 130/135 systolic is reasonable. Not 120, not 150, 130/135. Lower enough to provide some protection against stroke, but not so low that falling becomes the bigger risk. This is exactly what we adjusted James to. 132 systolic on average. He's 3 years out now, no strokes, no major falls. He's back to exercising, back to his golf league. Here's what most people don't realize about blood pressure. It varies throughout the day. One reading of 148/85 doesn't mean your pressure is always that high. It might be 132 in the morning, 145 in the evening. What matters is the average over time. That's why home monitoring matters so much. One reading in your doctor's office, that's limited information. Your average over 2 weeks, that's real information. So here's what I want you to do, starting tonight. These are concrete action steps. First, if you're over 70 and on blood pressure medications, Get a home monitor. They're inexpensive, available anywhere. $30, $40 maybe. Check your pressure at the same time each day for 2 weeks. Morning and evening preferably. Keep a written log. Don't rely on the monitor's memory. Write it down. Second, perform the orthostatic blood pressure test. Lie down 5 minutes. Check sitting pressure. Stand up immediately. Check standing pressure. Record the difference. If you find a drop of more than 20 systolic or more than 10 diastolic, bring that information to your doctor. Third, notice your symptoms. Really pay attention. Do you feel dizzy when standing? Do you have unexplained fatigue? Is your thinking foggy? Are you having trouble concentrating? These aren't signs of aging. These might be signs that your blood pressure is being lowered too much, even if the numbers look good on paper. Fourth, schedule an appointment specifically to discuss your blood pressure targets. Not a routine checkup, a conversation appointment. Bring your home log, bring your orthostatic measurements. Ask to discuss whether your current target is right for you, given your age, given your other conditions, given your functional status. Fifth, if you're experiencing side effects from your medications, speak up. Don't assume dizziness and fatigue are just how aging feels. Many times doses can be adjusted, medications can be changed, targets can be modified. And here's something critical about medication interactions. Most blood pressure drugs work by relaxing blood vessels or reducing heart rate, or both. If you're taking an ACE inhibitor like lisinopril or an ARB like losartan, these can interact with NSAIDs like ibuprofen. They can interact with salt substitutes. They can interact with supplements like potassium pills. If you're taking a beta blocker like metoprolol, it can interact with certain cold medicines. It can interact with some depression medications. If you're on a diuretic like hydrochlorothiazide, it can lower your potassium, which can cause serious problems. I'm not saying don't take these medications. I'm saying know what you're taking, know what it can interact with. If you add a new supplement or a new over-the-counter medication, tell your doctor. Before I finish, I need to address the elephant in the room. Your fear. You might be thinking, Dr. Kent, I had a stroke warning, or I have diabetes. My doctor is lowering my pressure for a reason. Should I question that? The answer is yes. But carefully, respectfully, with information, come to the conversation with evidence. Bring your orthostatic readings, bring your symptoms log, bring the research I mentioned. Say, I've been reading about this, I'm concerned my target might be too aggressive for my age. Can we discuss modifying my approach? Most good doctors will welcome this, will respect the informed patient, will be willing to revisit the assumptions they've made. Robert, the retired teacher, still takes blood pressure medication. 1 medication now instead of 3. His pressure averages 137 systolic. He hasn't had any cardiovascular events. He hasn't had any falls. He reads, he plays chess, he's got his independence. Margaret, 81 years old, back volunteering, back living, 1 medication, pressure averages 135 systolic. James, 73, 3 years post-stroke, no new events, 132 systolic average. Golf League member, engaged, living well. All 3 adjusted their approach based on understanding their individual physiology, not on following a universal rule. So here's what you now understand. What most people don't, what even many healthcare providers haven't fully grasped yet. 1, blood pressure targets are not universal. A person at 45 and a person at 85 should not be held to the same standard. 2, For older adults, especially those over 75, systolic pressure between 130 and 145 is associated with longest survival, best quality of life, fewest falls, fewest hospitalizations. 3. Pressure below 120 in this age group increases risk of falls, increases risk of orthostatic hypotension, increases risk of kidney injury, possibly cognitive decline. 4. Orthostatic hypotension. That drop in pressure when standing is often more dangerous than moderately elevated sitting pressure. It's preventable, it's testable, and most doctors don't check for it. 5. You now have knowledge to advocate for yourself, to have an informed conversation with your doctor. You're not passive anymore. You're an active participant in your own care. If this information resonated with you, if it answered questions you've been wondering about, then drop a comment right now saying informed. Just type the word informed and share this video with a parent, with a friend who's dealing with medications, with someone you know over 70 who's on blood pressure medications. You might be preventing them from a serious fall, a fracture, a loss of independence. Subscribe to this channel. My mission is bringing you research-based health information. Information that's accessible, practical, potentially life-changing. Next week, I'm revealing the truth about the 3 supplements that research actually supports for healthy blood pressure, and the 2 popular supplements that waste your money completely. The supplement industry is full of misleading claims, and I'm going to show you exactly what the evidence says. I'll see you there.